everyone. My name is Dr. Kirsten Fulong, and I'm here at Pinnacle Chiropractic in the Sarasota Bradenton area. And we serve a bunch of families and kiddos. And today I really want to redefine wellness and wellness care and what that means to you and I. And I want to talk about my story and how I got into chiropractic care. So a lot of you may have heard the word chiropractic and immediately your brain goes to neck pain, back pain, migraines, and headaches. But I'm here to tell you that there's so much more to chiropractic than just those things. And while those things are really effective with chiropractic care, we're really good at making sure people are living pain-free and full function, but there's so much more and it goes a lot deeper than that. And that's what I'm here to talk to you about today. So I'm going to go into my story and how I got here. So my dad is a chiropractor, and I didn't realize how blessed I was to grow up within the lifestyle of chiropractic. And so you might wonder, how has that impacted my life? When I was born, I was adjusted within hours of being born. So we're all three of my younger sisters. It was just normal for us. And so that might shock you. You might think, oh my gosh, adjusted? Were they cracked when they were born? No, it looks totally different with pediatric chiropractic. And the intention is different with it as well. So when you think about the birth process and you think about how much stress goes on that tiny spine, head, neck area, even in a normal, natural vaginal delivery, there's still some stress involved. And that's a lot being put on that tiny baby's spine through that process, which can affect their nervous system function. So all of my sisters and I were adjusted within hours of birth, some of them even minutes. And there's a reason to this, to release that stress and tension, to make sure we're setting them up and setting us up for a good life. So I didn't really understand why we got adjusted and all the different things and reasons more than just we got adjusted. I just kind of took it for granted when I was younger. But there is so much more to it. So it wasn't until I was in high school that I started working at my dad's office. I wanted to make a little cash on the side. He needed some help in the office with certain files back when everything wasn't on the cloud. So I was filing stuff. I was working up at the front desk. I was answering phone calls. I was booking people. And I really got to connect with a lot of patients. And getting adjusted was just a part of my life. I just was used to it. And I didn't realize how different we grew up from other kids until I saw other kids. Even in school, I noticed that other kids were different. They took more days off school because they were sick frequently. I didn't even know what the medications they were on because we'd never been on any medications. We never needed any medications. I would just hear my friends be like, oh yeah, I have to take this because I'm sick again, or I got to get my adenoids removed, or tonsils removed, or appendix, or you name it. There were so many different things I heard as a kid, and I just was like, oh, I guess we're fine. We just never needed all of that. And I didn't really connect the dots. I knew that we just lived different from other people, but I didn't really see why and the root cause why. So I got to know patients, and I would just see them light up. They'd come in. They were so excited to see my dad. They were so excited to get adjusted. They were so excited to see the impact that chiropractic had on their lives. And I started to see the stories and the miracles, when really, now that I'm looking at it, being a chiropractor, it was just unleashing the body's full potential. So I dipped my toes into it and then decided, even from a young child, seeing my dad come home every single day after work, and most kids see their parents come home after work, they're exhausted, they're just drawn out, their energy's gone, they're not really psyched to go to work on Monday, they're not excited for it, they're not passionate about it. But my dad was a whole different story. He came home fired up, he was full of energy, he loved what he did, he poured his heart into what he did. And there's a reason why, because chiropractic is freaking powerful. So the more I learned about it, the more I realized how much it was really impacting lives. So I realized that there was a significant reason why other kids around me in school and my sisters, but my sisters and I never needed antibiotics once between all four of us, We never needed to really see a pediatrician because we had no reason to. I mean, we got sick, we had the odd cold, we got through it, and our bodies recovered and they thrived. Our immune systems were strong. We got through all those things naturally, and we didn't need all these things. We slept totally fine. We ate well, we digested well, our guts weren't inflamed. There's so many different things that went into this, not only chiropractic wise, but also diet wise, lifestyle wise. We lived, breathed, and ate chiropractic in our lifestyle. So now I go to chiropractic school and I'm trying to figure out what my specialty would be. And I just thought, I just want to be a chiropractor. That's it. And I'm going through school, and within the first couple months of school, I found myself in the pediatric club. And so the pediatric club on campus was repping pediatric chiropractic care. And I was thinking to myself, well, the way I grew up and my sisters grew up was significantly different from other kids. And what was the difference there? We were all adjusted from birth consistently throughout our entire lives. There wasn't probably a week that I went without an adjustment. And that's because I was getting my nervous system checked. I was getting checked to make sure everything was functioning well, moving well, and everything was balanced in my body. So I took that for granted. I got adjusted even throughout university, throughout chiropractic school, obviously. And that shifted my focus within chiropractic to not just chiropractic, but chiropractic for pregnancy first and foremost, so that it's a healthy pregnancy. Then that shifted to pediatrics, so babies. So after the birth process, I wanted that those babies and these kids in our office that we see now to have the same opportunities that I did and my sisters did from a very young age. I think that shifts the trajectory for them for the rest of their lives, because if babies are adjusted from birth, and now I see that in front of me every single day, that's evidence in front of my eyes. The babies that come from moms that were adjusted during their pregnancy are significantly less stressed. They sleep better, eat better, poop better, do all the things that they need to do so much easier than the babies that come in where mom had a ton of stress throughout her pregnancy, a lot of trauma in the birth process, and a lot of different stresses that happened to that baby before they were even born and then during the birth. So there's a significant difference when chiropractic is involved. So I'm going to talk about the details now and exactly what does that mean? How is chiropractic making that difference for these moms and these babies? So the real secret sauce is found in the nervous system and its ability to regulate the autonomic or automatic nervous system. The autonomic nervous system goes beyond the tone and the tension and all the things that we think and know that chiropractic can work with, but it goes deeper than that. What we found is that when you address the autonomic nervous system function, you get to the root cause. So when the body's doing the things it needs to do automatically that you don't consciously think about, like pooping, sleeping, digesting, all the different things that your body's doing that you're just taking for granted throughout your day, that's what we focus on as pediatric nervous system focused chiropractors. So this takes me back to today, where I now work with pregnant moms, babies, and kids for that specific reason, to restore function, remove that stress, especially up here, and interference in the autonomic nervous system so that their bodies don't have to go through things like chronic ear infections, immune system challenges, severe gut distress, constipation, torticollis, sleep issues, behavior issues, ADHD, autism, all these different things that fall under the umbrella of stress. That's pretty much all it is. It all goes back to root autonomic nervous system stress. We take neurological scans in our office to see where they're storing that stress, how long it's been there, how severe it is, and we basically unleash, unlock, unwind that stress, bring the body to balance, and we see kids go back to functioning like they should. So it's not like we treat any condition specifically. We just unlock stress, and then their bodies go back to that function that it's innately intelligent to do. So everything is within your child and your body already to heal and thrive. There's just some interference somewhere in your nervous system. So you want to know what my favorite part of all of it is? We are taking these kiddos from chronic sickness and seeing doctors only when they're sick. So everyone dreads seeing the pediatrician, sometimes the dentist, because they're going to hear what's wrong with them. We're taking these kids from seeing the doctor frequently for all these issues that they have, and we're changing the definition of chronic illness to chronic wellness in our office, and we're ensuring optimal vitality and function of their bodies. So most of our patients that get that big idea, because once they see how their kids thrive under consistent chiropractic care that has that lens of the nervous system, they want to continue that. And they come to see us once a week or 2 times a month after they've gotten those results and that progress that they were looking for, or that initial reason that brought them to us. And they just come in just simply to maintain and keep going with their wellness so that it takes them way away from that illness spectrum. So they just want to stay on that path to wellness. And that's exactly why I do what I do. That's why I get it checked weekly to make sure my nervous system is functioning optimally. We take nervous system scans in our office, and we really try to address that root cause for whatever child or adult or baby or pregnant mom that comes into the office. If this resonated with you, drop a comment on this post. Reach out to anyone that might know of a nervous system focused pediatric chiropractor near you, and let us know if you have any questions. Have a wonderful day.